In this video, I'm going to talk about cardiogenic shock. Alright, some facts about cardiogenic shock is it happens when the heart cannot provide enough blood to the organs due to myocardial muscle damage. So it's caused by some damage to the heart, and the heart is pumping, but it's just not pumping enough to give adequate blood flow through the body. So that inadequate tissue perfusion causes tissue hypoxia. It's most commonly caused by a myocardial infarction or heart attack, and it is the leading cause of death in heart attack patients, with the mortality rate being of up to 70 to 90%. Some symptoms of cardiogenic shock is the skin will be cyanotic and cool. The peripheral pulses will be rapid and faint. The jugular veins will be distended. You'll usually hear some crackles in the lungs. You'll see some peripheral edema. You'll hear distant heart sounds. There'll be some altered mental status or confusion. There'll be a decrease in the urinary output. The patient will feel some chest pain or discomfort. The patient will also experience fatigue and tachypnea. Now, the hemodynamic monitoring for patient in cardiogenic shock, you will use a Swan-Ganz catheterization to monitor those hemodynamics, and the patient will be hypotensive. The pulmonary capillary wedge pressure will be elevated. The cardiac output will be decreased. The SVR will be increased. The MAP will be decreased. The CVP will be increased. And the mean vascular O2 will be decreased. Some medications that can be used during cardiogenic shock are vasopressors. Those will augment the coronary and cerebral blood flow. It will increase the cardiac output. The vasodilators will relax the smooth muscle, which will also increase cardiac output. The antiplatelet agents will help keep the blood thin and prevent clots. It'll also make it easier for that blood to flow through the vessels. The opioids will help relieve the pain. The patient will have some chest pain with this, so these medications will help that, and that will also decrease the sympathetic stress on the patient. The diuretics will help reduce the peripheral edema, which is causing the pressure around the heart, and you will need to give the patient some oxygen to improve the oxygenation status. The ABG values for a patient in cardiogenic shock are as follows. You'll have a uncompensated metabolic acidosis with hypoxemia, so the pH will be low, the PaCO2 will be high, the bicarb will be low, and the PaO2 will be low. Now for ventilator treatment for a patient in cardiogenic shock, they will often need ventilation assistance. Invasive ventilation with intubation is usually preferred for airway protection. Positive pressure ventilation, it will help the patient's oxygenation status, but it's not recommended for a patient in cardiogenic shock due to the increased pressures that are already around the heart. Those pressures and positive pressure ventilation will just increase that even more. So that could be dangerous to the patient. Initially, you want full ventilatory support for the patient, and you're going to put those settings based off of the ABG result and the patient's ideal body weight. You will just go with the standard 6 to 8 mLs per kg of ideal body weight for the tidal volume setting. Here are my sources.